The broadcast is now starting. All attendees are in listen-only mode.
Hello, good afternoon, everyone. This is Rebecca with WFIA. Thank you so much for joining us on our weekly call. Just to get us started, I wanted to remind everyone that we do leave everyone in listen-only mode until we get to the question portion, at which point I will unmute everyone. So please make sure that you are muted on your end, either the little microphone tab on your computer or your phone should have a mute button that you can hit. So just go ahead and make sure that's done on your end. And if you want to ask questions, we have, you can either wait till we unmute, or there's the question panel on the side there, or you can click the little raise your hand button and I'll know that you have a specific question and get to you at that time. So with that, I'm going to go ahead and hand it over to Jan.
Hello, this is Jan G., President and CEO of WFIA. Thank you for being with us today. Yesterday afternoon, we were on staff going, okay, well, what do we have that's new and important to our members for tomorrow? We're going, oh gosh, not too much. Well, today has exploded, and I think we have a lot to share with you today. So, and looking for a lot of input from all of you too. So today we're going to be covering, we've got best practices from Mike Latham, Town and Country will be sharing. Kristen Wyson from King County with their face covering recommendations / requirements. The governor just released at 1:30 today requirements for restaurants and tavern reopenings. We're looking at that to see how that impacts you opening your eating areas in phase 2. Also, we got a draft from the governor's office today. He didn't release it, fortunately, because we had a number of concerns, but phase 2 of limited in-store retail operations, and they rolled the grocery stores in with general merchandise retailers. I'll highlight that. Also, we're going to talk about meat pricing and advertising laws. Tammy's going to give us an update on mask supplies, and we might as well get started here. So remember that you can ask questions at any point in time in that question box. You can also make recommendations to us for other agenda items, either today or in the future, or just ask us a question on what we're dealing with today. Mike Latham is, he is the Director of Food Safety and Loss Prevention, and he has been our hero in our association on all things food safety. And we have a permanent seat at the State Health Department on the Food Code Council, where we discuss everything food safety and rewrite the food code. And Mike has been holding that voting seat for us, although I do attend with him too, and he interacts, but he's there voting on your behalf. And he has done all of our previous workshops on food safety, and we'll be doing that again as the food code gets completed with the many changes that they're proposing right now. Thankfully, they've put that on hold till we get through all things COVID. So Mike has a best practice that his owners and management have said, of course, share our resources with the rest of the retail industry. So Mike has 15 minutes to introduce to you a document, and it's been posted on our website if you're there and you wanted to pull it up. And it's under New This Week. And let's see, Melissa, what TNC COVID response plan. So it's right there that you can pull up if you want to follow along with Mike. And Mike, are you ready to take over?
I believe I am.
Great, thank you.
Okay, good afternoon, everyone. I know that most of you know me from the workshops. When you look at this document, it will look a bit overwhelming from the surface because there's so many pages to it. But truth of the matter is, the best well laid out plans for execution are those that really have a lot of details to them. And I will tell all of you this because I think this is critical to understand, that regulatory compliance, this would be your local county jurisdictions, those people that come in and work in your stores, they love stuff like this. They love details. They love to know the things that you're doing in the event of. And there have been situations where some locations have been closed. And it's really from the fact that when local county jurisdiction comes and they assess the situation, and the person is going, well, you know, we don't know what to do. Tell us what you think we should do. That's where they start to really get a lot of red flags. And when you have a very detailed plan that you can sit with them and say, here are the steps that we follow, these are the things that we do, here's the people that we interact with, and here's the information that you'll get from us. Whenever they get that type of information, they're incredibly supportive to help you remain open and keep things moving. So just kind of food for thought. You have the document today, as well as one that I asked to be given with this, which is a comparison chart of a cold versus the flu or even coronavirus. And you'll see some similarities. You'll see certainly some differences there. But one of the most interesting things is it's been said that the fever is the onset symptom for COVID-19. I've actually been able to confirm through several different doctors, there is a precursor to even a fever in many cases, and it is lower blood oxygen saturation levels. If any of you go and you have physicals, it's the little clip that they put on your finger that tells your oxygen saturation in your body. And keep in mind, COVID-19 is a respiratory flu. And when you get it, you start fluid buildup in the lungs, which is hypoxia. And your body compensates with breathing deeper or whatever it is so that you can continue to have the right amount of supply of air. But what happens is more hypoxia starts getting created in the lungs. Then you get to that point of where you're struggling to breathe. And what some of the reports that are coming in, and it's not complete yet, is that if people were to get to the doctors and the hospitals with the start of the depletion of their blood oxygen saturation levels. So in other words, instead of being 97 when you're down to 90 or 80 some, your body's reacting, but you're not really feeling that sick yet. But if you got to the doctor by that period of time, before it got too bad, possibly would not require having to go on a respirator. So more to follow on that, but just something interesting I just thought I'd share with you. Also, when it comes to perceptions, customers are watching everything your employees are doing and or not doing to keep them safe. They too will be observing your new norms in sanitation practices as areas within your stores start to reopen, like salad bars, olive bars, bulk foods area. My suggestion to all of you is right now start communicating to your employees as well as your customers your new standards for long-term sanitation for those areas before the reopening actually starts to occur. And I have to feel very confident in how well you do this right now will determine the confidence that customers have when all of these areas start to reopen. Just a little food for thought. Jan asked me to be brief in conversation today about my document. And I'm going to just give you, if you really don't have the document to go through while we're doing this conference, I'm going to reference it by page so that you could go back and look at more of the detail by page if you just have a pencil and paper and you write down a page number. So number 2, the largest risk of exposure on COVID-19 is droplet transfer. Someone has coughed or sneezed and it's in either the plume of air from their cough or sneeze, or it's from something they have touched without washing their hands. The primary exposure points of your body are always going to be your eyes and nose. There are no reported cases that I am aware of that someone has contracted COVID-19 by eating something. Once swallowed, the acid in your stomach will eradicate the virus. So that's on page 2. When we go over to page 4, that's the next one that I wanted to highlight. And Jan just asked me to highlight some of the more important points. Communication is critical. I've been in some stores and I've talked to some people where they've just said, our company really isn't sharing anything with us. We really don't know. Well, your employees and customers hear information from all sources, and unfortunately, some of them not very reliable. We created an email update platform within our company for all employees that signed up for it, and it was overwhelming the amount of people that wanted to do it. So that is our way of constant communication with our employees. And we also keep our company website updated so that our customers can be going there and looking information up on COVID-19 and or things that we say to help keep you safe. Also on page 4, as I mentioned earlier, same sanitation, new norms. We're adding hand washing station in or close to our delis for hot foods, soup, salad, and olive bars. So basically, one of the new norms that we've created for ourselves that we're going to be putting into our plans is that we will have a hand washing station in our deli area as one of the new norms that we follow with for the future. Page 5, sanitizing of pay terminals. You know, when we talk about sanitizing and those things that are really important to keep sanitized, I've actually heard some people say that at their pay station, as an example, they sanitize it every hour. Seriously? Customers are standing there looking. They don't care about who was there 15 minutes ago. They don't even care about the person that was there right before them. They want to know that when they touch that machine, that it's going to be clean. So my suggestion is sanitizing the pay terminal screen and keypad, and do it between every transaction. Every time a customer touches it, it should be wiped down. And you can, and we did this as well, we put a small plastic film over the keypad so it makes it a little bit easier to clean without the risk of damaging the keypad. Another highlight area is page 6, bulk foods. You know, up in Snohomish County, one of the doctors on their Board of Health, probably 4 weeks ago, said that they wanted all of the bulk foods closed down. And really not thinking this thing through very far. And it was kind of interesting that King County actually did the same thing, and they went in and closed down all of the bulk as well. And I called EHOB, who was their COVID-19 response coordinator for King County, and talked to him about gravity flow and what were the risks associated with it. So we were able to get gravity reopened back up. And then now Snohomish has allowed gravity to be reopened again. So again, communication with your local county jurisdiction, those people in your health departments, and all of you should know the director of the health department in every one of your counties. And that way you can be communicating with them and asking questions as you see things and give them your approach towards sanitation and how you would be doing this. And I know that they're all very, very open to it, as well as the state health department. Let's see. One new thing that we've added that is not on the response plan is for our count rooms, because there's a lot of money in there and it can get dirty from time to time, and it's a closed environment where a few people throughout the day work in. We actually bought short wavelength UV sanitation lights for all of our stores to be put in these rooms. Now, the light can be moved around. It's very portable, but it operates between 200 and 300 nanometers, which is the low end spectrum for high ultraviolet. And it's really a great sanitized step. This is something, and it comes with a remote control, the one that we bought. You can turn it on at the end of the day and it'll sanitize. And when everyone comes in first thing in the morning, the room's clean, it's sanitized. Or you can do it right before someone goes on shift. And the amount of time that it takes to sanitize a small room like that is generally 15 minutes. So it doesn't really take a lot of time, but something interesting that you might want to add to your arsenal to keep things safe. On page 8, if someone tests positive, steps to follow. Part of what Governor Inslee talked about in his press conference today was investigation of close contacts. A lot of steps got left out of it, so I think that's something for Jan and I to talk a little bit more about. But Governor Inslee, I'll go back to the first press conference a week ago. Governor Inslee stated that there are 5 benchmarks that will dictate how quickly we move through the phases of reopening. Disease activity, obviously wanting to see a decline in positive cases. Healthcare readiness, do hospitals have the space and enough respirators to handle stuff? Testing capacity and availability, are we getting the test kits and getting them quickly? Risk to the vulnerable populations, how well can we keep convalescent homes and nursing care facilities safe? But lastly, this case and contact investigation. I really strongly feel that this is a part that we can all play a part in, and it'll have to be coordinated with our individual county health departments. But I can tell you that in the cases where we've had positives within our company, I've done the contact assessments and I've reported everything to the health departments because they trust and they rely on our support and our help. So it's worked very, very well. But more to follow in conversation with Jan, and we'll see where that actually goes. Another highlight point, page 12, sanitizing is broken down into 2 parts. We have a sanitizing for the back of the house versus practices of continual sanitizing of the cells floor. So for our back of the house, when the store closes of an evening, everything gets clean. Restrooms, hallways, every piece of equipment that would be touched through the day, furniture, chairs, tabletops, those things where people work jointly, where maybe 2 people might share the same desk, telephones, everything that could possibly be touched, in most all cases, by someone throughout the course of a day. And again, this is all back of the house. All of those areas get sanitized. For our on the floor side, we're just constantly doing sanitizing, and even in our deli departments, a good rule of thumb, and this was something we did even prior to COVID-19, and got such excellent response from our consumer base, is that every 2 hours, there is a wash, rinse, and sanitize of serving instruments on all of our salad bars, soup bars, olive bars. I know it's a burden, I know it's extra labor to do it, but if you really think about how important is it that customers want to feel safe, it's pretty damned important. So again, just something to consider that you may want to step that up. Also on page 12, personal protection equipment. Some people have said they really struggle with masks, and some of the cases that they've actually stated why it made sense, because one person who I spoke to felt they'd come close to drowning and were suffocating, and it was just a fear for them to have on a mask. But we provided face shields, and that really was a big help for that individual. We've got eyewear as well as gloves. Masks are now considered by the World Health Organization and CDC to be a safeguard that everyone over the age of 2 should be wearing when out in public. Mayor Jenny Durkin of Seattle just stated that it's now a requirement for people in Seattle to wear a mask in certain situations, that also including grocery stores. So masks are a critical thing. In the beginning, it was really the importance of them for someone who may be sick to prevent them from getting someone else sick. But there is just enough of this being spread that the decision was made by all organizations, everyone, wear them. And I just want to share this with you. Not sure what approach your company is taking to force someone that enters your store to wear a mask. In our stores, roughly 75% of all customers currently are wearing masks. For the balance of those who are not, we're offering free masks to those that need or want one. And I stand by this as a fact. And now I'm getting off onto one of my tangents. People, customers, require 3 things. And when I say require, it's not what they want, it's what they require. They want to feel welcome, they want to feel appreciated, and they want to feel like they're a part of your operation. With that said, our customers have been making masks in large quantities for our employees and customers to use. It makes them feel like they're just a part of what we're doing, makes them feel like they are a part of our success. So I encourage you, if you want to learn more about customers' needs versus wants, speak to Jan. The next round of food safety classes that I'll offer for WFIA will be on in Eastern as well as Western Washington. On the subject of mask, I do want to say from personal observation, it tells me that some people just really don't understand the purpose of their mask. I see quite a few people wearing a mask to simply cover their mouths. The nose is the risk, not so much the mouth. Check how your employees are wearing them. Customers are observant. I'm going to say that again. Customers are observant. And the way your employees are wearing their mask is a reflection on how serious you're taking COVID-19 and how serious you're taking their own personal safety. So if you've got employees that are improperly using them, please educate them so that they have a better understanding that the primary risk for infection of COVID-19 is by droplet transfer either to the eyes or to the nose. So the other part is keeping your hands off of your face and certainly a lot of washing of hands. On page 13, a contingency plan.
Just a couple more minutes, so just want to give you a heads up.
Okay.
Okay, great. Go ahead.
Okay, on page 13, there's a contingency plan, option 3. We just never want to go there. How good of a job you do in following through on sanitation practices and communicating your confirmed positive cases and investigation with your health departments will determine that you don't have to close your stores. Page 16, employees returning from international travel, we restrict them, something you may want to do. And with thermometers, we've made it strictly voluntary, and that's on page 17 and 18. We've made it strictly voluntary. We've not gone to mandatory, and it seems to be working well.
Awesome. That was speed time there, Mike. Thank you. Hey, and
Okay.
I thought it was a great value for Mike to share his document because he has shared it with us and it's on the website in a Word format. And he says you are welcome to pick and choose and use any part of it or all of it, whatever you might want to create a more comprehensive document, because this may not be the first time we're going through COVID or a pandemic, right, Mike?
Yeah, and I just had someone, the CEO, just try and call me, so it overrode everything on my phone, so I didn't hear anything you just said. But if there were a question, I'm ready for it now. But I also want to tell you, please feel free to take this document. We're a part of WFIA, and we're a part of all of making our state better. So if in any way this document can be of support to you and your organization, just simply change the names on it and make it your own plan, and certainly put your own people in, their names and numbers, not mine. But anyway.
Thank you very much.
Janet's Melissa. We can only post PDFs on our website, so if somebody does want the Word document, then they will need to reach out to one of the staff to get that.
Okay.
And
so, Rebecca?
I was just going to say before Mike leaves, we do have a question in the question box.
Okay, real quick. Okay, we're going to make Rebecca the point person on receiving that Word doc. So like everybody's email, so she's Rebecca at wa-food-ind.org. Go ahead, Rebecca. One question, and then we'll have to wrap this up.
Mike, can we get the link to the UV sanitizing mechanism that you were referring to for the count rooms?
Sure. There's actually quite a few of them. I just got them off of Amazon. And the only thing that you just want to keep in mind is with any of the sanitation lights, UV lights, you want them to operate in the 200 to 300 nanometer range, because that is the range of ultraviolet that is sanitized. But there's a lot of different ones to pick from.
Okay, great. Great information. Thank you. Thanks, Mike, and you're welcome to hang on, or maybe Bill's calling you to get off and take care of something else, but we appreciate you very much. I'm going to turn
You're
this
welcome.
over.
I think I need to run and catch the next ball that's in the air.
Okay, we have King County on next about their recommendations/requirements on the mask. You might want to hang around, but go ahead, Tammy.
I will definitely hang around for that.
Okay, Tammy, it's
Okay.
all yours.
All right, thank you. So this is Tammy Hetrick. I'm the Vice President at Washington Food Industry Association. And as we reported out yesterday, King County did make an announcement on requiring face coverings anywhere in public, including grocery stores. So I've been frantically checking around to figure out supply issues, and I've been working with King County, and I have Kirsten Wyson on the phone. She's a policy analyst for health policy and planning in the Director's Office of Public Health for Seattle and King County. And so I thought maybe she could help us and answer some questions. And you do have a poster that we sent out that is going to be required. So make sure you have that posted. And with that, Kirsten, I will let you go ahead and speak on this.
Okay, thank you so much, Tammy. And it was, thank you also, Mike. That was very interesting presentation. Everything's so clean these days, but that is how we defeat COVID-19. So appreciate everybody's efforts in so many grocery stores. Yes, it is true. On Monday, which I believe was only yesterday, yes, Executive Dow Constantine, and City of Seattle Mayor Jenny Durkin, and Dr. Jeff Duchin, our local health officer, and Matias Valenzuela, our public health department's equity manager, gave a telebriefing to the press, and Dr. Jeff Duchin released a directive to wear face coverings in many public settings, most public settings. This is pretty typical. It's happening around the country in California and a bunch of other places, and of course in many Asian countries. As I think Mike mentioned, originally, like early in the outbreak, masks were seen as and they primarily are seen as a way for, like, if I wear a mask, I am preventing any transmission of virus from me to you, to someone else that I'm in the vicinity of within 6 feet, for these aerosolized droplets. But now we do know COVID-19 is a pretty unusual virus because it transmits before we show symptoms. So this 2 or 3 day period where I could be completely unaware that I have COVID-19, I'm still talking to other people or, touching things, and then I could inadvertently transmit it to another person. So these face coverings, and they can also be disposable masks. The main point of this local health officer directive is to try to not have members of the public or businesses going out and buying those special N95 high filtration masks, because those are still a shortage for our healthcare system and long-term care facilities. And even next up would be childcare businesses that really have the greatest need for these high filtration N95s. But any kind of cloth face covering or a disposable mask is starting, I think, on Monday, May 18th, going to be required when we here in King County are in an indoor or an outdoor public space where we might be within 6 feet of somebody who isn't already in our household. So it does include grocery stores, pharmacies, corner stores, other retail stores, restaurants, our marijuana stores, tobacco shops, and our public transportation system. I also want to say that to me, this is a way to show gratitude and respect to our essential workers, and in particular, grocery store workers have been, really working so hard, so many hours, and they've been so busy and have been putting their own health at risk. And that when customers wear face coverings into a store, to me, that's a way to thank the essential workers in that store. So that was the directive. There's just really quite a bit of information online, kingcounty.gov/COVID, including we have these downloadable posters in English and 8 other languages showing different types of masks. And as Mike mentioned, also kind of the right way to wear a mask and make sure that it does cover both your nose and your face and your chin. And we have some specific information for deaf, hard of hearing, blind community members and their caregivers, because it definitely is a very unique situation for someone who is deaf or is a lip reader, and for their companions and their household members who communicate by sight and lip reading. So there's some particular information there. And I'll just close with this last comment. Dr. Duchin did say that we really don't need every single last 100% of everybody who lives in King County to wear a mask. A lot of our strategies to reduce the spread, like washing our hands and staying 6 feet away, and staying home when we're sick, even if we get to this idea of 50% of the population doing it, 75% of the population complying, that really is has a very, very strong impact to reduce the spread of COVID-19. So we had a lot of debate internally about whether a mask would be recommended or required, because we do want to give space to people if they have a health condition, if they have a mental health condition, if they have a phobia, if they're hard of hearing, if they are with someone who they need to be lip reading. Of course, Black and Brown people risk some level of violence from maybe a security guard or from the police if they're perceived to be involved in a crime. So we're really trying to create the space for people who have a good reason not to wear a mask, but then try to get 50 to 75% of people to wear a mask in order to protect our community from the spread of COVID-19. And I would be happy to answer any questions that you all may have.
So Kirsten, I wanted to thank you for your time while we wait for some questions to pop in. Oh, shoot. Oh, I think we lost me for a second there.
We didn't lose you. You're good.
Excellent. So I wanted to thank, first of all, the city and the county both for hearing our concerns and making sure that this wasn't something that was enforced by our grocery stores or by employers. That was a huge risk we were concerned about. And so we appreciate that this is strongly required or recommended, but that it's not being required to be enforced by our members. So thank you very much for that consideration. And then I'll just open it up for questions now.
So this is Rebecca, and I am opening it up, but as I'm doing that, nobody is muted on their end. So if you could just take a moment and look to make sure that you're muted, so that we're not getting dogs barking and other background noise, that would be great.
I would like to ask a question while you're getting some member questions in. Kirsten, because I know Tammy's been working with all of you up there, trying to even identify where our members can obtain masks of any sort. Do you have any hopeful messaging for us there?
Hi, yes, thank you. There is at kingcounty.gov/COVID, there are some frequently asked questions about these face coverings, including, I don't know, there's like 22 questions here online, and there is question 19, 20, 21. There is some information about the distribution of free cloth masks. The city of Seattle is working through community-based organizations, and I will look up the list. I think they're really like the YMCA and United Way to distribute free masks to people who
do that. I know it's kind of,
homeless, older people working at food banks. King County is distributing 100,000 masks. Metro is distributing masks. Many have been donated. There is the Seattle
so interested in the 480s.
Brigade. The Seattle Mask Brigade is another option. But for buying, we are in this weird situation of just trying to procure and buy them. So you might have better information than I do about buying either cloth masks or disposable masks.
Thank you.
I have a question, if it's okay. This is Brenna Davis. I'm with PCC. I first of all want to say thank you so much, Kristen. I appreciate you coming on. I know how busy you are. I have so much gratitude for you. And I just want to ask a clarifying question. We've been debating internally a little bit because the directive says that you must wear a covering, but the guidance says wear a covering, and it appears to be a recommendation. Can you clarify, is it a must or is it a recommendation? Thank you.
Oh, thank you for that question. And honestly, we have been working for like 10 days with lots of heated debate about that question of, is it a recommendation or a requirement? It is, here's how this, if you look at the wording of the local health officer directive, it does say that masks are required. But it also says that the level of enforcement is going to be from an education perspective. I thought Mike Latham said it really well during his presentation, which is, hey, I notice you're not wearing a mask. Would you like to have a mask? It really isn't from the perspective of you can't come in the store if you're not wearing a mask. And again, this is from a scientific point of view. Number one, I'd never want anybody to lose sight of the fact that the most scientifically proven ways to reduce the spread of COVID-19 are to wash our hands for 20 seconds with hot water and soap, and to stay 6 feet away from other people, and to stay home when we're sick. So when we all do those three things, then maybe the fourth thing that we can start to think about is wearing a mask or a face covering. But it isn't like the whole virus is going to spread if someone isn't wearing a mask. If they're not wearing a mask and they're more than 6 feet away from somebody else, there's no possible, way for them to be transmitting right in that moment. So we're kind of soft pedaling the requirement, and it's a little bit like the pooper scooper law, which is a law. You're not allowed to have your dog leave feces on someone's yard, but the police are not going to come after that person. This is kind of a we self-enforce with each other. Maybe sometimes we come on too strong with a neighbor who let their dog poop. Maybe sometimes that neighbor's got some issue that we just don't understand, and it's not our business. So it's required, but there is an educational enforcement, not a criminal enforcement. So all the police forces have nothing to do with this requirement. And to your point too, employees, and God forbid, we've seen some crazy stories in other parts of the country where employees have been put at risk from having to enforce this. So it's a nice to have, but please don't lose sight of the fact that the top 3 things are to wash our hands, clean commonly touched surfaces, stay home when we're sick, and stay 6 feet away when possible.
Kirsten, thank you very much. We appreciate you visiting with us all today and giving us clarity, and appreciate the posters, and we'll get your website up so the posters in other languages can be accessed.
So this is Rebecca. There are a couple of questions coming into the box. One said, I noticed the face shields are not included. Are they allowed for face coverings?
Yes, and I am,
Oh, I think we may have lost you.
okay, sorry, no, it's my inability to unmute. Face shields are a great solution, especially because you can see people's faces and their mouths. So talking and communicating actually seems to be easier with face shields. The clear plastic face shields, those are great. And disposable masks are fine. We are emphasizing cloth masks just because it kind of seems to be the easiest thing for general members of the public to secure. But employers have great guidance from OSHA and Center for Disease Control, and from your food safety consultants and the State Department of Health. And I think for employees, you are working on administrative ways to stay safe with staggering schedules, but also these engineering ways to stay safe from viruses with the plastic barriers and face shields. So that is a great solution. We just didn't want to create like a burden for the general public.
Great.
Did you have another one, Rebecca? Yeah, 2.
I think that this one may have been answered, but I'll read it real quick.
Okay.
What about employees that say they can't wear a face covering for the reasons you state? Are there exceptions for them?
Yes, of course. And the local health officer directive really does have a list of important exceptions, and including people who are deaf or disabled people have, if you cannot yourself take a mask off, that could cause a breathing problem or somebody to pass out. So we really need to go into this new world with gratitude for people who are able to wear masks and acceptance for people who are not able to wear masks. And to know that if 50 to 75% of us wear masks, that really does help reduce the spread of COVID-19.
Great, thank you so much, Kirsten. I know we got you on the spur of the moment, and we appreciate your time very, very much. And you're welcome to stay on if you want, but we will say thank you, and if you want to check, please go ahead.
Okay, and Tammy, I believe you have my contact information, and our food establishment program manager, Eob Mazangia, and his team are just brilliant and always wanting to work with grocery stores and food establishments. And I just want to extend my appreciation for all the hard work of all the grocery stores and food establishments these days. I have no idea what we would do without you, and let's just stay in touch. Thank you for having me today.
Thank you. Okay, next we're going to jump into a couple of the governor's proclamations. One he talked about today at his 1:30 conference. These are phase 2 requirements, proclamations, because some counties are allowed right now to move into phase 2. So we're seeing the governor's office come out with a number of guidance documents for phase 2. They are moving so fast, unfortunately, they sometimes forget to reach out and talk to the people they're impacting. So the first one I wanted to cover is the phase 2 restaurant and tavern reopening requirements. And this is where you are allowed to have 5 guests. Now, this is going to impact your eating areas if you have tables, sit-down areas at the grocery stores. It will impact where they're talking about the social distancing and the limitation on the number of guests. The concern here that we have is we've got 2 different interpretations in the governor's office. One is that we have to have, even if they're getting their food from the deli and going over and sitting down at a table where it's self-serve, that we have to have a log of the name, email, and address, or email and phone number of the customer for tracing. The other interpretation is no, that's only if you're offering table service. So we will have clarification on that. And of course, we're going to work with the governor's office that self-serve is exempt from that requirement. But for our truck stops that have the restaurants or any of the others of you that actually have table service where you have people waiting on the tables, then that would impact you. The document is posted onto our website. Most of the requirements, again, unless you are a sit-down full-service restaurant, they will not impact you. The interesting thing that we saw in the other document that is in a draft form release is phase 2 limited in-store retail operations. And interestingly enough, we've been operating for the last 6 weeks. The other retail organizations have not, but they put the grocers in with general merchandise retailers. It's not working very well. And we're requesting the governor's office to separate those out because there is, with the restaurant document, it is saying that the guest occupancy must be a maximum of 50%. It says of the maximum building occupancy, but of course, you would be looking at your seating area, both your inside and your outside seating area. So that is phase 2. We will still not be allowed any buffets or salad bars in phase 2. It will still be either table service or self-serve at the counter. I'm going to jump into the other one, the limited in-store retail operations declaration by the governor, and then we'll open it for questions on either one of those. This document right off the bat limits customer traffic management to 30% of the maximum building occupancy as determined by the fire code, not counting your employees. So we were on a phone call with the governor's staff just before he had his press conference at 1:30, and we noticed that he didn't really get into detail on this, and I think it's because his staff flagged it and said, we're not ready yet. So Rebecca did get an email survey out to our grocery stores and convenience stores asking questions. We need to understand what the true impact of that is. The large national chains were on the telephone with me talking to the governor's office, and they said that they are already at a 50% maximum building occupancy minus employees, and that is pretty standard even when there is no COVID. So that's why I caution my remarks until we get our survey back on that. The well, we do know they're going to go to customer count. So I was thinking what a timely thing it was that we had Kevin Weatherall last week talk about his counters that he purchased to have over the doors, because it appears that the governor is moving toward that. He is also moving toward taking King County's lead. The confusion of requiring / recommending so masks for both employees and for the public. There is no language in here for us to police our customers, but there's very strong language in here that the public and our customer and our employees are required to wear masks, and that the employers, it says the personal equipment should be provided by the employer for the employees. So we queried that too, and the governor's office is going to interface with L&I on that particular issue. So the state is moving. They say their rationale on this is as they move into phase 2 and phase 3, they're allowing more people out in public and more activities, and therefore they need to, I would say ratchet down, but they say increase the safety measures. So the occupancy rates, the stronger language on the masks, that type of thing. So I'm going to open now for any questions on those 2 documents.
Jan, if I could very quickly, I just got a call from the governor's office while Kirsten was speaking, and they said the governor is going to announce later today the 30%.
Oh, well, that's not good. We were hoping we had them talked into going to 50%. Okay, my phone kept ringing and I didn't want to get distracted, so thank you for that, Tammy.
Yeah, I figured I better grab it.
Well, thank you.
This is Brenda. Can I ask a question about that, Tammy?
Yes.
When you say going to 30%, like, is that immediate, or is that at a certain date, or have they shared that with you?
That is, that's phase 2. No, it is phase 2. The documents I'm talking about right now are phase 2. So only those, we have 7 counties right now that are granted permission to go to phase 2. But as soon as the county, wherever you're located, is granted permission to phase 2, that's when it kicks in. Phase 2 kicks in.
Okay, thank you, Jan and Tammy.
Yes, yeah, these are phase 2 docs.
Okay, and he is announcing that later today, so we'll have more details as soon as he does his press conference on it.
Okay, Jan, this is Don Stoltz. Hey, I just want to, and maybe I'm out of touch with what's going on in Seattle or something. I have not seen a single grocery store, independent or chain, that is doing anything to monitor occupancy. I see it at Home Depot, I see it at Lowe's, I see it at other, but I have not seen a single grocery store doing that.
Well, we haven't been required to do that. Are you saying because they made the statement, the Nationals said that they're operating at 50%?
Yeah, I guess that's what I'm questioning, is that they're saying that, but I don't see anybody controlling that. And if that statement is influencing the governor to come out and say we have to be at 30%, I mean, this is one of the most significant, I think, things that has come up in the last few weeks.
Yes, it is. And it was a bombshell death. They didn't even consult with us, and up to the date, they have consulted with us days in advance over all of these policy issues for our feedback. So this was a bombshell to us. And a disappointment that the governor's office staff is now, their communications are breaking down with the impacted parties.
Hey,
Yeah.
Jan and Don, Dave Martin with the Myers Group. I noticed that Payless Foods on Whidbey Island is now counting customers in and out and holding them in a line in front of the store.
But I want to be clear about what the National Grocery Store said today, their association, that under normal circumstances, they only operate at 50% minus employees, at 50% of the operation anyway, that they don't operate at 75 or 100% of capacity. So I'm sure it did have some influence, but you know, we don't always think the same as the national grocery store chains, but we still try to cooperate and work together when we can.
Yeah,
Yeah.
I guess I understand that. I guess I'm just raising the issue because it's the significance of it in the next couple of weeks, that if we can put any effort into trying to fix this or change it or whatever, because when they make that kind of statement, I mean, if you've been in a 60,000 square foot Safeway store on 4th of July and you got people lined up in 15 check stands and they're 8 people, 10 people deep, there's no way they're at 50% of occupancy, and they're doing nothing to control it. So sending the signal that that's okay, I think is causing a problem.
Well, I can't control their regional association, but I can control what we say. And I did, that survey went out, Rebecca sent that out. I would ask that you would all check your email from us and respond to that survey, so I have something to back me up on. And also, I think, to make sure you understand what your fire code occupancy is and how you normally operate. So I don't, you know, I don't want to fall on my sword unless my blood is worth it.
Sure,
So,
I get it.
Yeah. Okay, so please answer the survey.
I have one more clarification. So I texted the governor's office and they said that we'll have 2 weeks to come in compliance. So when the governor makes this announcement, he's given us 2 weeks.
So this is phase 2.
They're obviously changing everything on this.
Well, phase 2 is supposed to become effective on June 2nd, I think it is. So we'll clarify that if it's phase 2 expected to go into place on June 2nd still, or if they're just going to require this even under phase 1. We'll get clarification. We obviously, you could, Tammy, text Nick right now and see what time this afternoon he and Sherry can have a conference call with us to clarify some of this stuff, if you would, please.
Yes, I'm doing it right now.
Okay, I am going to go to, after all of that great news, and I want you, I mean, literally, these just got dropped on our laps, you know. With the Department of Health, they sent us a draft. Last Thursday, we responded within 24 hours. And then on Sunday, I get an email back going, oops, we didn't get through all of our emails, didn't see your comments, and we already commented. And even at that, there was no language there about keeping this log on customers. So things are changing so rapidly right now in the governor's office, I think, because they're getting a lot of pressure to reopen Washington. They're scrambling, trying to figure out how to do that and still keep people safe. So I want to jump quickly, if I could, to meat pricing, because we've hit a problem this week with the fact that our stores need to have their ads submitted by 2 weeks in advance for print and distribution, and you're putting meats on sale price and advertising, and then all of a sudden we're seeing every couple days increases in the meat pricing, and it's there's no way for you to meet those prices. So there are laws on the book that says if you advertise it, you got to sell it for that price. And there's also laws that say you can't advertise a special unless you fully expecting and can document that you expected to get it in on your order. So we are working right now with our meat suppliers, our warehouses, getting the pricing and going to work with the AG's office and the governor's office to make sure that we're giving exceptions to those laws, that you don't get a bunch of lawsuits filed against you because you renege on those advertising prices. So I have no idea how successful we'll be because they are laws on the books, but we are collecting the meat pricing only to share with the AG's office and the governor's office to try to resolve this. We got notice yesterday from FEMA that the pork is 30% offline in the slaughterhouses. So things are not getting better, they're getting worse. And finally, Tammy, jump in quickly, have a quick update on masks.
Yeah, so, I've been working on this issue quite a bit. We've checked with some of the distributors that we have, and it sounds like quite a few of them are getting some masks. And then, Jan's been also working on this. And good news, at first we were concerned because they were mostly disposable masks. And when King County came out with their notice, it was cloth masks. But, we were able to get clarification. Obviously, those are fine. So we've been told that most stores should be able to place an order and have masks in their store by next week at the latest. We're still trying to find more resources, especially with cloth masks. And there's still some delays. Those are kind of expensive, but we'll keep working on that and keep notifying you if we see any more problems on that.
Where can we place these orders?
So many of the distributors here in the state have them. If you can't get them at your distributor, then let me know. Please email me and I can share the resources that I found with you. And it's Tammy, Tammie, at wa-food-ind.org.
Tammy, what do you mean by distributor?
Our warehouses.
Oh, you're talking about the emergency management delivery?
No, our members, I've been reaching out to a lot of them to find out.
Okay, so I know, so your Majestic Glove, who's under the umbrella of Bunzel, Tammy's been coordinating with them and trying to get the delivery over to Bunzel. Those are all for purchase. Did you want to talk about what emergency management just emailed us?
Oh, sure. I'm sorry. I thought I was going to leave that for you because that was really great news. And
no, go ahead. Go ahead.
You had done most of the work to get that. So it sounds like Jan has been working on that also. And we've got some requests out there, and it sounds like we might be getting some through emergency management. And I guess we'll find out for sure.
Well,
and those
the
are
long the long promise shipment, but the long promise shipment's down to 49,000 the end of this week or early next week. But like I said to them, well, we'll believe it when we see it. But I said that's not all we need. We need more. So when you get your next shipment, we need more. So we'll see, but we certainly will let you know through your warehouses immediately. So 15,000 over into Eastern Washington, the balance over into Western Washington for convenience stores and retailers, the grocery stores. Okay, next week we have at popular request, John Ross, CEO of IGA International, is coming back to give us an update on the China grocery store sales and thoughts on on the grocery industry post-COVID. And tomorrow afternoon, don't forget to register for the new laws webinar that Cat Home is organizing. We have new laws, some coming into effect June 11th, some coming into effect later. She will also be talking about the new overtime rule, the white collar, the EAP rule. We could not get a delay in that. The whole business community worked. We could not get a delay on it. And it is true, it won't impact most of you the first 2 years, and the impact starts, unless you pay in bonuses. So you'll want to pay a lot of attention to that if you pay any of your wages in bonuses. So we're gonna, because we're already 7 minutes over, sign off. But if there are any questions by any of our members, if you want to stay on, we'll stay on and try to answer the questions. Did we have any in there, Rebecca?
Some of them have been answered behind the scenes, just responding to people. Somebody did ask for clarification. This is all retail occupancy, not just grocery or restaurants.
Right.
And then Rosars is metering all of their stores.
Okay, great. Your head start with Kevin Weatherall. Okay.
Hey, Jan. This is Andra. This is Andra at A&J and Stevenson.
Yeah, you got to open this week.
Well, we've been open. Unfortunately, they announced it to the world that we were open when we went to and it didn't seem to matter that we didn't actually get approval for phase 2 until Monday. But so the occupancy, I didn't see that on the website where that document was about how we've now been classified with all other retail establishments and the 30%. Is that not out in a document yet? Is that, am I understanding that was the bombshell that landed during this call?
The bombshell landed about 12:30 this afternoon. And so the staff went and asked the governor to pull it for the 1:30 conference, press conference, until they had time to work with the industry. So obviously they don't want to work with us because the answer is going to be 30%.
And I just received notice that we're going to get an email later today with the details. So we'll send that out as soon as we get it.
Okay, good. Thanks.
Yeah, I've got the document in hand, but hopefully they're going to give us further guidance with it. So I did not post the document because I was told it was a draft.
Okay. All right.
Yeah, and we're supposed to have the final later today.
Well, it's ironic that, the grocery industry's been operating for the last 6 or 7 weeks with little or no guidance. And now all of a sudden, we have to do all of these things.
That was our point to them. Yes. Anybody else? Feel free to sign off if you want to, but anybody else have any last questions for us? If not, I guess we'll talk for the new laws webinar tomorrow afternoon and next week with John Ross and any other bombshells the governor's office lays on us by then. So thank you so much. Have a great week.
Great call.